Surgery gone wrong.
Brain surgeon operates on wrong patient. A neurosurgeon from Kenya's biggest hospital has been suspended for operating on the wrong patient. Apparently, 2 men had been taken to the hospital last Sunday. One needed surgery to remove a blood clot in his brain, while the other needed some meds for head inflammation. Luckily, thanks to alert and careful hospital staff, both patients were labeled incorrectly. It wasn't until hours into the surgery when doctors found no blood clot and realized they cracked open the wrong head. In a statement, the hospital said it deeply regrets this event and has done all it can to ensure the safety and well-being of the patient in question. Maybe they didn't do everything they could to ensure his safety. Besides the massive hole in his head, the patient is supposedly in recovery and progressing well.
This is what an ass surgery gone wrong looks like. Jane Park, the youngest ever winner of Britain's Euro Millions, was reportedly left unrecognizable after an allergic reaction to a Brazilian bum lift operation that she got in Turkey last week. The 21-year-old who won £1 million from the Euro Millions lottery in 2013 when she was only 17, has now reportedly squandered about £50,000 of that prize money on cosmetic procedures. And those are said to include a 36FF boob job, a full set of dental veneers, liposuction, Botox, lip enhancements, cosmetic filler, and now the Brazilian butt lift. Last week, the jackpot winner flew to Turkey and spent a couple of days enjoying the luxuries provided by a celebrity clinic, where she then received her elevated ass. However, she panicked after the surgery, discovering her face had swollen dramatically from an allergic reaction to the anesthetic. Although doctors told her the reaction would eventually subside, the event apparently really freaked Park out. After winning the lottery, Park made headlines for all the wrong reasons. In 2016, she was banned from driving for 18 months after getting nabbed for drunk driving at a McDonald's drive-thru in Edinburgh. Earlier this year, Park claimed she wanted to sue lottery operator Camelot, saying her life would have been 10 times better if she'd never won the loot. Oh, poor girl. You know, somehow we think there's plenty of people or causes she could have given the money to. Oh, wait, and she wants to sue the lottery people for money? Whoa, nice on the irony. Actually, Camelot sent a financial advisor to help Park manage the horrific burden of all that free dough. So what you guys think? Any sympathy? Let us know in the comments below.
Chinese mom threatens to disown girl who's addicted to plastic surgery. 29-year-old Yu Bing recently made headlines in mainland China for her crazy plastic surgery experiences. Yu had some 20 plastic surgeries in the past, including jaw contorting, nose reconstruction, and double eyelid operations. But she is still not satisfied with her looks and says she wants to grow taller by having bone extension surgery in which a doctor would break her shin bones to insert implants. Yu desires to be another Fan Bingbing, a world-famous Chinese actress. Fan, known for her perfect skin, big double eyelid eyes, and sharp nose, has long been troubled by a plastic surgery scandal. The actress strongly denies the accusations and says she was born pretty. Yu's mother went on a talk show aired by Dragon TV to complain about her daughter's plastic surgery addiction. The 61-year-old mom said her daughter has already blown 800,000 Chinese yuan on changing her looks, and now she cannot even recognize her. She threatens to disown her if she doesn't stop. Yu seems remorseful after listening to her mom, but ironically, her face forbids her from crying because she's just got surgery that would keep her lips upward all the time. We tried to find out more about Yu's personal life by going on her Weibo, but we're not exactly sure if this is her. Trust me, we really tried. This woman has the same name as Yu and looks roughly the same. But you know, millions of Chinese girls who had plastic surgeries look exactly the same. It's getting really hard to tell who's who.
You get what you pay for. Eloy Alviso thought fixing his flat nose would land him more gigs. Instead, the aspiring Filipino model's dreams came crashing down after a back-alley cosmetic procedure ruined his face for good. He went to a transgender beautician and got a nose and chin job via collagen injection for 500 pesos, or roughly $10. The injection worked, and Alviso got more jobs. But 2 years later, things started to go downhill after a friend noticed that his nose seemed a little deformed. Soon, both his nose and chin had become swollen and infected. When the 24-year-old tried to ask the beautician for help, he was cursed out and threatened. Doctors eventually found a lethal cocktail of petroleum jelly, wax, and sealant crammed inside his nose instead of collagen, and performed surgery. With his now permanently scarred and mangled features, Alviso is forced to do odd jobs, often moonlighting as a Halloween ghoul. Police are still looking for the transgendered beautician, but already have a warrant for her arrest.
Lip plumping surgery fail. Woman can't pucker up. A woman in Taipei traveled to South Korea for a simple lip plumpening surgery. Only when she returned home, she discovered she was unable to pucker up. In addition to transferring fat from the woman's abdomen to her lips, the plastic surgeon also injected a muscle relaxant into the muscles around the woman's lips. It was because of the relaxant that the woman discovered she couldn't pucker her lips or even drink through a straw because the muscles of her mouth were unable to tense properly. Also, a week or two after the surgery, the transplant fat had been reabsorbed by the woman's body and her lips returned to their original condition. Now back to the thin lips she originally had, but no kissing skills left, the woman sought out a cosmetic surgeon in Taiwan who injected Botox into the muscles around her mouth to tighten them. So after all that money, fuss, and traveling, she's back to square one. At least now she can go back to posting duck face selfies.
Dental wire from braces found lodged in woman's intestines. You might be surprised by some of the items doctors discover inside the bodies of humans in emergency rooms, but chances are they've seen it all before. When something new is found, though, it's newsworthy. If you've ever worn braces, you can relate to how annoying they can be sometimes. A woman in Western Australia last wore them in her early 20s, but a decade later she began complaining of agonizing pains in her stomach. Doctors initially thought it was her gallbladder when the pain subsided after they gave her some meds. But when she returned 2 days later, still suffering, a CT scan revealed a foreign object had punctured her small intestine in several places. They thought it was a fishbone, but after performing surgery to have it removed, they found a 7-centimeter long piece of wire, likely from her old braces. Doctors were surprised to find the wire because the woman, now 30, hadn't worn braces in so long. As reported in the medical journal BMJ Case Reports this week, they believe the wire had been lying dormant in her system until it punctured her small bowel, leading to pains. The most commonly found swallowed items in adults tend to be fish bones and chicken bones, but doctors also frequently see items we try to hold in our mouths, like bobby pins or screws.
Well, he definitely made his mark. Doctors get up to all sorts of nastiness during surgery. Some fondle their patients, others trash talk them, and then you have this weirdo who brands their organs. Liver surgeon Simon Bramall was quite the Zorro, using an argon beam to mark his name on the livers of 2 patients during transplant surgery. Argon beam markings aren't harmful to the liver and normally disappear over time. One female patient's liver didn't heal properly, though, and another surgeon was shocked to discover Bramhall's initials during a follow-up operation. Bramhall was suspended immediately after the discovery, but ended up resigning anyway later after going through disciplinary hearings. The surgeon has since pleaded guilty to 2 counts of assault by beating for marking his patients and will be sentenced on January 12th. But while most doctors were scandalized, one of SB's former patients thinks it's not such a big deal, since at the end of the day it's more important to save lives. Still, that's some twisted sense of narcissism. What do you think?
Medical accidents at all-time high in Hong Kong hospitals. Public hospitals in Hong Kong listed 49 serious accidents this year, the highest number of cases in recent years. Incidents include situations where medical equipment was left behind inside patients after surgery. One more serious incident happened when a 6-inch tube was left inside a patient's head after brain surgery. The patient had to have a secondary surgery to remove the piece of medical equipment. Another incident saw a piece of pipe from a pump detach itself in a patient's liver, once again requiring a secondary surgery to remove the pipe. Doctors say the increase is due to the complexity of equipment and the number of surgical procedures conducted in Hong Kong this past year. 20 of the incidents involved medical equipment left inside patients, and 12 of the incidents involved removing tool fragments. Medical staff may not be aware that part of the tool is broken off inside the patient while doing the final count at the end of a surgery. 5 other incidents involved medical errors, confusing patient identities, or the parts of the body that required surgery. There were also 19 incidents of patient suicides while at hospital or during the recovery process. Medical professionals claim that some of these are new problems that have emerged due to new technology, and they're still coming up with solutions.
Tracy, you are going to die.
What? No!
When I tell you who I'm dating. Squeaky Fromm.
It sucks when you're misdiagnosed by a doctor. It sucks even more when the doctor mistakes you for a corpse. 41-year-old Colleen Burns was rushed to the hospital when she overdosed on some Xanax and Benadryl. It's unclear how the doctors at the hospital misdiagnosed death, but they pronounced her clinically dead. They obtained permission to harvest Burns' organs and were all ready to slice her open when she opened her eyes on the operating table, no doubt scaring the crap out of everyone. Turns out Burns had only lapsed into a deep coma and wasn't dead at all. The hospital discharged Burns 2 weeks later without even an explanation for how they could have mistaken her for dead in the first place. After the health department said that doctors ignored signs that Burns was still alive, the hospital was slapped with a fine of just $6,000.